9, 10. Testing. This video shows a functional electrical stimulation system that allows traumatic complete paraplegics with a complete severance of their spinal cord at anywhere between the T1 and T12 levels of their spinal cord. It allows them to ambulate short distances independently and without braces. This system received full approval by FDA, the Food and Drug Administration of the USA, in 1994, and it is presently commercially available. It was the first and is still the only system to have received FDA approval. It was invented and developed by Dr. Daniel Graupe, professor at the University of Illinois in Chicago and member of the Board of Trustees of KSI Institute in Skokie, Illinois. The system is totally non-invasive, using skin surface electrodes as shown in the video. It is designed for full independent use by the patient. It requires 7 to 10 minutes to put the system on without help from an outsider. This can be done in the morning when the patient gets up, and it requires 3 to 5 minutes to take it off in the evening. The system, whose commercial name is the Parastep, is based on a microcomputer that simulates in a gross manner the neural commands from the spinal cord to the peripheral nerves that cannot go through due to the injury to the spinal cord. It therefore sends the artificial signals instead of the natural ones to selected peripheral nerves that are involved in standing and in walking. Average walking distances for a single walk after 33 training sessions over 3 months are 350 feet per walk. That is for training sessions that are held 3 times a week. When training sessions are held daily, then after 4 months of training, of daily training of an hour and a half a day, average walking distances were reported to be 1,500 feet. That is 4 times as much as before, nearly 5 times as much. Tests at the University of Miami Medical School have shown that after 33 training sessions, as above, blood flow to the lower extremities increased by 50% or more on the average. Psychological measures of depression and of self-concept were shown to significantly improve in that same study. Also, resting heart rate was reduced by 10% on the average, and spasticity was significantly reduced. Presently, over 500 patients have used the system. For further information, please contact Dr. Daniel Graupe at the University of Illinois in Chicago. The phone number is 312-996-3085, 312-996-3085, fax 312-413-0024, 413-0024, 312, or contact KSI Institute, which will refer you to Dr. Graupe. Dr. Graupe authored over 80 papers and a textbook on the subject, and nearly 200 papers and 4 textbooks in total. The system has been used by patients whose injury occurred as little as 9 months prior to starting training with the system, or as long as 40 years earlier, 40 years earlier. That is for patients who spent all these years in a wheelchair. I wish to emphasize that the system is not a replacement of the wheelchair. It is, however, intended to allow the patient to walk short distances at will and independently without assistance whenever the patient wishes, not to replace the wheelchair altogether. Thank you very much.